Thank you, Madam Speaker. Madam Speaker, I rise to make some brief comments on this motion, which from the onset I'll say it's a good motion, but I don't believe that it's a motion that has been well thought out. And I say that being cognizant of the fact that health is devolved, but if you look at the budget of 2025-2026, the Ministry of Health had initially requested for an allocation of about 426 billion, and they were given 132.4 billion. Now, if you look at the 132 billion that has been given to the Ministry of Health, what the Constitution says is that the national government shall be responsible for the following areas when it comes to the issues of health. One is the national policy. Number two is national standards. And number three is referral hospitals. Madam Speaker, I do not see the reason as to why a motion should be drafted to now call upon county governments. And this is why sometimes I think we need to be very thorough in terms of our research so that we know exactly what we're talking about. If the Ministry of Health, headed by Honorable Duale, is already receiving 132 billion shillings just for policy, for national standards, and for a few referral hospitals which are available in the country, which is money equivalent to 10 years allocation of my county of Narok. And now you come up with a motion that says that the county government to allocate more funds to their respective health dockets to adequately facilitate their county level 5 and level 6 hospital in order to enhance provisions for critical health services and reduce the demand for such services from the National Teaching and Referral Hospital. What exactly are you saying? Already, you've given counties very little money. You've given my own county of Narok so little money that it cannot even cover the 1.5, 1.6 million people that reside in the Narok County. You're telling them, take that budget, instead of the regular 30% that the county allocates to healthcare facilities, you're now asking Narok County to allocate 50 or 40% of their budget. Yet you're retaining all the money in the Ministry of Health. All the money in the Ministry of Health. In fact, the first thing we should be saying here is that this number 2, which I completely do not agree with it, and I want my colleagues to be reading these motions carefully. When a motion is brought, don't just support a motion because it sounds good. It sounds good for us to have health referral hospitals in every region. Of course, there's no doubt that if we had a situation whereby county governments were given more money and referral hospitals were built, it will lessen the burden that Kenyatta National Hospital is already facing. Now, if you want to convince me on this motion, first of all, allocate more money to Kenyatta National Hospital. Kenyatta National Hospital, out of the 134 billion shillings that has been allocated to the Ministry of Health, 18.1 billion is what has been given to Kenyatta National Hospital, and 1.75 billion that is given to their doctors. Madam Speaker, we need to be practical. We cannot just be debating motions here which will not help this country develop. If we are talking about coming up with policies that will enhance proper healthcare in county levels, develop county level 5s, level 5, level 3, level 2 hospital, and putting more money in primary healthcare, I'd be the first one to clap the hands. But I'm not going to stand here and say I fully support this motion when I know very well that where the government is going to be looking for money is by denying counties money and giving more money to the Ministry of Health. I completely disagree with giving more money to the Ministry of Health to build referral hospitals when a lot of the money that is given to them, they have very little to show. Very little to show. I want more money to be allocated from the Ministry of Health to Kenyatta National Hospital. I want more money to be allocated to Eldoret Referral Hospital. Before we can even start talking about building new level 6 hospital, and we do not have money. Madam Speaker, a good governor, a former governor, friend of mine, who was a governor of Kakamega, was very ambitious. You know, he built a huge hospital, which ended up becoming a big elephant project. Recently is what I heard that the ministry was taking over that project. Let us not try to chew, to bite more than we can chew. Let us learn to live within our means, Madam Speaker. No wonder, Madam Speaker, the IMF today is fighting so much to devalue the Kenya shillings because they do not want Kenya to be able to have a favorable balance of trade. These are things that we have to be objective in looking at them, Madam Speaker. I would be very happy if we had hospitals that work, if we had a healthcare system that works. But when we are still struggling to be able to make sure that SHA works well, to be able to make sure that our level 5, level 4 hospitals are fully equipped, and they are able to, we're able to train more nurses to be able to provide healthcare to our people. You know, if we were able to do that, I would be the first one to say, okay, we've succeeded here. Now let us move and start saying, calling for level 6 hospitals to be built in all regions. Madam Speaker, it is not just a building that means that people are getting better health care. It is not. It is the quality of service in those hospitals. Can we first improve the quality of service in level 3s, level 4, and level 5 hospitals in our own counties before we start saying, let us bring another big monster? Soon, what will happen, Madam Speaker, is that money will be sent to level 6 because everyone will be bypassing level 5, level 4 hospitals, and level 2 hospitals. Let us try to improve our primary health care first before we try to say, okay, we want to lessen the burden in referral hospitals. Yet that burden in referral hospitals of having many people being referred to is because our level 5 and level 4s are not working. So, Madam Speaker, I don't support this motion. I'm now fully convinced that I do not support it. I will only support this motion when I can be told that the 134 billion shillings that we sent to the Ministry of Health to be able to develop same standard, national standards. Number 2, to support Kenyatta National Hospital and to support Eldoret Referral Hospital, you know, and also to come up with policies is actually working. Currently, it is not working. Let's call a spade a spade. It is not working. The moment we pass this motion in this House, Madam Speaker, you will see in the next division of revenue, there will be less money going to counties. Why? Because Senate has said, let us build more referral hospitals. The Ministry of Health and the Ministry of Treasury will say, gentlemen, in the last financial year, the Ministry of Health had requested for 426 billion. When they requested, we cut it down to 132 billion. We did that because we did not have money. But now, gentlemen, distinguished senators, you've come up with a beautiful proposal that we should build referral hospital. That means, and also on top of that, you've told counties to increase more money of their budgeted for the healthcare docket to the healthcare. So now we need more money, which means now we will reduce the money that is going to go to county governments. We need to be realistic. There's something called intended and unintended consequences. The unintended consequences of such a motion will spill doom to our counties. Let us try to live within our means. Let us build our level 5 hospitals. Let us better them. Let us fully equip them. Let us come up with a system where we can be able to prescribe medicine to every part of this country. And whether or not that drug is available in the hospital, it can be available in a pharmacy. And a person who is sick can continue getting the medicine they require, and they can be able to get the services they require. Today, Madam Speaker, if you go to our hospitals, you'll find that the doctors there have got clinics outside town. They will tell you, I will refer you to Kenyatta National Hospital. And they'll take a pen and they'll write Kenyatta National Hospital for this. Or we'll take you to Eldoret Referral Hospital. However, there's a clinic in town. If you go, they'll be better off to serve you. Why not improve our level 5 such that the referral cases become very minimal? As I conclude, Madam Speaker, I want to be very clear on my objection to this motion. One, there's no doubt that having referral hospitals in every region will lessen the burden that is currently with the Kenyatta National Hospital of so many referrals. There's no doubt. Number two, and there'll be no doubt that many people will get access to more training. But the question to ask is this. Although these are all positives, access to specialized healthcare services will be, just around the corner. It will also probably foster medical research. The question to ask is this: with the current situation, have we been able to tick those clear points, positive points, that there'll be more access to specialized care? Have we been able to deal with it currently? So, Madam Speaker, I believe that it is time that we become realistic. We improve the healthcare. The moment we've improved the healthcare completely, our level 5 have been equipped with doctors, have been given, improve more money that you're sending to doctors even in the first place. If you're saying for level 6, you are giving them 1.75 billion in Kenyatta National Hospital alone. Now, when you build many, how much more money will you be sending, and you don't have that money? And you have your big brother IMF there telling you, first of all, devalue your currency. So, I do not support this motion. I feel like we first of all need to better our healthcare facilities in the county levels, improve them, so that once they are doing better, and there is need for these specialized services, there is need to foster research in our institutions, and there are resources, local resources. Only at that point should we then agree to be able to now support a motion that sets up new referral hospitals in regional centers. Let us learn to live within our means. We cannot be spending what we do not have. We can't. Every day, Madam Speaker, if you take your phone, you will find requests for money to pay hospital bills. Now, when you are taking money that is very limited to be able to go build these big white elephant projects, will those requests not triple? So, Madam Speaker, with those many remarks, I oppose this motion.
Senator Lominen.
Thank you, Madam Speaker. I beg to move that the debate on this motion be adjourned